आता है इसको पढ़ना 2.5 साल की कहाँ तो एप्पल आता है.
So what is this showing, doctor?
See, this is showing the oxygen level in the blood, the saturation, oxygen saturation in the blood. On room air it was 86 to 88. Now once we put her on oxygen, it's going up to 95, which shows that whatever lung issue she has is reversible. Should be reversible. Now reversibility in the sense, of looking at a blood gas value or oxygenation level, whether it translates into reversibility after the surgery is the question, because a lot of them may be reversible with these tests, but whether they will reverse after the holes are closed or not is going to determine the outcome of this operation.
This child suffers from a syndrome called Swiss cheese VST, a complicated heart problem which affects the lungs. Doctors say that she really ought to have been taken in for surgery when she was 3 months old. Many of these children are arriving a bit too late and then resulting in you having to really push boundaries.
Yes. See, that's the problem with the entire subcontinent, and more so with this country in Pakistan, where pediatric cardiac facilities are very few. So usually these patients would have had a pulmonary artery band which would have protected the lungs. For some reason this girl has not had even that. So her lungs are totally been exposed to excessive flow. I think the problem, coming to your point, is even medical doctors, fully qualified doctors in our countries, advise children to get bigger before they come for heart surgery, because they see heart surgery as something which is very traumatic and a small baby cannot get over it. On the other hand, it's quite the opposite. A small baby is born with organs which are completely normal, and if you can correct a defect before it starts damaging an organ, the ultimate outcome is much better actually. So you operate them late thinking that the result will be better, but it becomes worse. So,
How does it work in the West?
In the West, all neonates get a echo after birth. So their heart disease is picked up 100% of times, or close to 100% of times. And they obviously get operated in time, because 90% of heart defects need to be fixed soon after birth.
Days after she was admitted in this hospital, Binish Fatima is finally being taken in for her surgery. The surgery is going to be a difficult one, and everyone is crossing their fingers that she pulls through.
That's okay. It's very complicated.
So, doctor, finally you've decided to operate. How is she looking now? Is she better?
She's actually been very playful once she got rid of her infection, running around in the ward, and I think she should be okay, provided we do our job properly.
I'm sure you will.
Gone good.
The next 5 hours seems almost endless for Fatima's parents. They've been warned by the doctors that this is not an easy surgery and that it is not without its risks. They have only prayers on their lips for their little girl. Finally, the doctor emerges and explains how the surgery went off.
Operation's gone okay. I think we got most of the VSTs. She is right now in a slow heart rate. Hopefully it will recover. So we'll have to observe that also. Sometimes if the heart rate does not recover, we need to put in a pacemaker.
After a 4.5-hour surgery, baby Fatima is now back in the ITU. The next few days will be crucial for her recovery.
The problem with many of the children coming for heart surgery from Pakistan is that they end up needing to stay longer than their visas permit, and that causes additional anxiety and hardship for the parents.
कुछ बच्चों को कुछ केसेस बहुत सीवियर किस्म के हैं, तो वो कुछ लोग 3 महीने से ज़्यादा हो गए हैं, किसी को 4 महीने हो गए हैं. लेकिन मसला ये कि वीज़ा जो है ना उनका एक्सपायर हो चुका है. 2 मंथ्स का वीज़ा है. अब वो बड़ा यहाँ पे वीज़ा एक्सटेंड कराना जो है ना बड़ा मसला है यहाँ पे.
कहते कम से कम 4 मंथ्स का तो होना चाहिए, क्योंकि हर कोई भी रुकना तो नहीं चाहता. हम तो चाहते हैं वहाँ चले जाएं.
Once the authorities in the visa section of Indian embassy in wherever, in Pakistan or wherever, once they realize there is an authentic certificate from us stating that the child requires a major intervention on the heart, they should make it as pleasant as possible. They should not be asked to come many times, because you see, they're not coming here on a holiday. They're coming here to save the life of someone who they love.
10 days later, and baby Fatima's heart rate has still not improved. The doctors have now taken a decision to put in a pacemaker. After 3 to 4 weeks in and out of intensive care, the little girl is finally on the road to recovery.
I think in front of her eyes she is improved, and I think if the trend should continue and she should keep improving. So the child's body has a tremendous capacity to adapt and come back to normal.
बहुत अच्छा लग रहा है, बहुत खुशी हो रही है. उस वक्त जब आए थे तो बहुत परेशान थे, लेकिन डॉक्टर साहब से मिलकर और डॉक्टर साहब ने जिस तरह से बताया था, सब बहुत अल्लाह का शुक्र है, बहुत सब कुछ अच्छा हुआ है. बहुत शुक्रिया है गवर्नमेंट ऑफ इंडिया का कि उन्होंने हमारी इतनी हेल्प की है, और पाकिस्तान की और इंडिया की दोस्ती इससे मजबूत हो.
And what can we say about this little girl, except that she won our hearts right through?
Thank you.
Doctor ka naam?
Dr. Chamma.
What do you think that these children coming from Pakistan have really done to foster friendship?
I think the relationship between India and Pakistan has to get better. It is just a matter of time. The future is not an extension of the past. First of all, pain and suffering has no boundaries. If a child in Pakistan is in pain, for me it's as good as a child in India is in pain. So if there is a child in pain and we have the solution, I think it's a responsibility of society to ensure that borders don't come on the way.
Bye. Thank you. Bye. See you soon.
So the ordeal may be finally over for baby Fatima and her parents. Next week, she will be back in her home in Karachi, and hopefully in a year or so, she will go to school like children her age. This has indeed been a journey of hope. Tell us what you thought of this program by writing into us at feedback@ndtv.com or feedback@ndtv.in or SMS us at 6388. Till our next episode then, goodbye.